Hello, my name is Allison Warner. I'm the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists, where she was a featured speaker this past weekend at their annual session, which was held virtually. Hi, Jackie. How are you doing?
Hi, Allison. You're right. And we've just spent Friday, Saturday, and Sunday at the AAO virtual meeting with over 100 presentations. Yeah. And it really was an honor to present Friday evening on OSHA, FDA, EPA, and CDC guidance during the pandemic. So it was 55 minutes of jam-packed information.
Well, if anybody didn't get a chance to see Jackie's session live, do know that if you are registered for the AAO Annual Session, you can access those lectures for 30 days after the closing day. So yes. Keep that in mind. But we want to talk a little bit about what came out of the AAO. And one of the lectures, in fact, it was one of this year's keynote addresses that is always really chock full of great information, is the one by Chris Bentson from Bentson Copple Associates. And Chris does a great job of looking at the metrics and uses those to forecast the future for the orthodontic industry. And Jackie, I wanted to see, what was your main takeaway from Chris's lecture this year?
Well, as I listened to Chris speak, he looks at the numbers, and he's so good at interpreting all of those numbers and applying them to the forecast for the future of orthodontics. Yeah. And he estimated that, we're going to be seeing more of our patients and treating them with aligners, that maybe more than 50% of your patient cases of the majority of orthodontic practices will be treating patients with aligners in if not the very next year, in the next couple of years to come. Yeah. And then one of the other interesting things that he brought up was where right now orthodontics are as busy as they can be, and the title of his presentation was "This is your moment." All the people that have been in Zoom meetings, they're looking at their teeth up close and going, "Oh my gosh, I need to go to see an orthodontist." There's those pent up Zoom smiles, I guess, that he interpreted, and many of those are adult patients. Yeah. And he also brought out looking at the birth rate in the United States. The birth rate is declining in the United States. And when you look at the the millennials and the Gen X and all, we're going to have less children that are going to need orthodontic, because there are just not that many children. Yeah. And yet we can continue to care for patients and provide the maximum number of orthodontic smiles by including those adult patients. Yeah. And so with our focus on sterilization and infection control, I thought, well, how is that going to affect orthodontic practices in the future? And I looked at sterilization and thought, well, we're probably going to need less ligature cutters and less dental distal end cutters, so less cassettes for doing wire and brackets, but maybe more, maybe an aligner cassette that has the pliers that we need to make an adjustment, that the orthodontist can adjust an aligner. So we'll probably need more of those, or maybe you need to invest as you reach a tipping point in your practice that you're seeing more aligner patients, that you have a setup of those pliers at each of your orthodontic chairs. Okay. And providing the assistants with exactly what they need to care for the patients. So I think those adult patients coming into the practice, and the adult patients are much more observant about clean and sterile, and are you doing everything that they've heard about on the news and in social media to protect their safety and well-being. So if you haven't updated your sterilization system, now's the time to seriously start looking at it and look at your office from an adult's perspective. We've made it fun in the orthodontic office for children, and we've had all of the games and the prizes, but now as patients shift and you see a greater percentage of your patients are adults, then it may be time to change some of your systems in the orthodontic practice.
That's a good point. Well, given the fact that we're talking about an increase in adult patients and an increase of aligner cases, this does go back to a current issue that, you know, a lot of orthodontic practices have been struggling with in the last several months is staffing shortages. So this all sounds great. So what's your advice to orthodontists who are worried about that and how they're going to accommodate all these patients?
Oh, this was staffing shortages and was a huge topic throughout the different presentations
Yeah.
with the virtual AAO meeting. And as I've been looking at the challenge with us, my thoughts go back to how can we maximize the time of that clinical excellent orthodontic assistant, the one who has great communications with the patient, great hands, has a rapport with the doctor that, you know, he or she can almost read the doctor's mind and anticipate. And that's what several of the presentations were talking about when they talked about efficiency in the clinical area and how to maximize the ortho team. But my thoughts were, you know, there are a lot of tasks that we do in the orthodontic practice that don't require that clinical assistance expertise.
Okay.
So what about hiring a team member, a new team member that's maybe not trained in orthodontics,
Okay.
that doesn't know what a wine guard is yet? And are there tasks that could be delegated to that team member that would relieve the chairside assistants and maximize their time? And the model's been used in general dentistry where there was a hygienist shortage for many years.
Okay.
We would have the dentist would hire a hygiene assistant to assist the hygienist in between patients so that the hygienist could efficiently move from patient to patient to provide that direct care. So the hygiene assistant would disinfect the chair, provide the next patient's scheduling where it's done in the operatory, maybe even provide oral hygiene instruction. So let's look at ortho. And in implementing that in ortho, there are tasks that could be done, such as wiping down and disinfecting the orthodontic chair after the assistant finishes, transport those instruments into the sterilization room, and then even sterilization. But to be able to delegate those tasks, there are going to have to be a few planning strategies in the
Right.
orthodontic office.
Yeah.
First of all, you need to have systems in place that allow you to efficiently and quickly train an inexperienced person to do that task, to do it correctly. And for many years, I've looked at the Japanese 5S system.
Okay.
That is, how do you organize a procedure, or even it started with manufacturing, like with Toyota and manufacturing automobiles. And the 5 S's stand for sort. You have to sort out all the tasks that have to be done with that particular objective in mind.
Okay.
And then the next one is going to be that you are going to set in order each of those tasks. So you go from 1 to 2 to 3. Well, you've heard me talk about the sterilization room. It has to move from dirty to clean to sterile. So
Right.
that's part of it. And then once you've done that, you put the shine on it. So you've organized your workstations, if you will, and then you make it immaculately clean.
Yeah.
Whatever the task is, if your instruments, or if you're doing aligners, if your plastic supply, if your digital printing is not in clean working order, then it takes longer and it requires more expertise. Whereas everything's set in order and it's shining and clean, then that brings it to the next is standardize it. Do it the same way each time so that you don't introduce the variables that could cause errors or lapses in care. And then finally, the final S is sustain. So even though you put a system into place, we can get lax. We're human. We get in a hurry.
Right.
So then looking at, okay, are we keeping it clean? Are we putting the shine, the sparkle in it? You know how I like that, sparkle and shine with it. Are all of our instruments in good working order? Do we have efficient systems? The equipment's up and working. And so I think that's what we need to look at. What are the tasks that could be delegated to a non-clinical, a chairside assistant? And that would include, like I said, disinfecting, maybe running oral evacuation cleaner through the lines. We've learned how important it is to keep the evacuation lines clean so that we get maximum suction during the pandemic with aerosol disease transmission. So we're doing that more frequently. And then restocking the unit. There have to be disposable supplies, and the sterile instruments have to be in that chairside unit. Well, if you've got it all set in order and maybe even color coded per chair, then a non-clinical person could easily restock all of those units and make certain that the supplies are there for the assistant when they sit down to care for a patient. And then even seating patients in the chair. You can have a concierge that comes out to welcome the patient and walks them through the initial process, gets them seated in the chair, and it's all set up for the assistant to slide in, provide the care, the orthodontist to come by, evaluate how the patient's progress is going, and then the assistant finishes, and as she moves to the next chair to treat another patient, the orthodontic assistant would provide all of those non-clinical tasks with it. So I think that's where we may need to go in the future. And it's a great entry level for the orthodontist team, because as they're doing those non-patient care duties, then they're also learning about the orthodontic office, and you could move them on through more training and even maybe introduce them to more training through how to take an impression for an office that still does impressions, or how to do that intraoral scan where they're doing more aligner treatment. So there's a lot of tasks, I think, that could be delegated to that non-clinical assistant that would allow us to both train new assistants and get them chairside with patients in the state where you don't have to be an RDA or a CDA. And you've got to look at your state laws and be in compliance with the state laws as you implement this type of system.
Okay. Well, it all seems to come down to better utilizing or dedicating the staff who are skilled and experienced, letting them do the work that needs to be done, and realizing that you can go hire someone who maybe doesn't have that full skill set, but you create an opportunity to give your clinically experienced and skilled people more time to do their job. So
exactly, they, emptying the trash can be done by another team member rather than an experienced chairside assistant that's providing that direct patient care. So maximizing our time. Hey, I think we can look at a paradigm shift in the orthodontic office, if you will.
Yeah, great. Well, thank you, Jackie, so much for offering your advice on this topic, because I know it is a concern, and it's something we've covered and comes up a lot, and and we don't know yet when the staffing shortages will resolve, but for now, thank you for this solution. And I would say to our viewers, check back soon for the next episode of In the Sterilization Room with Jackie. In the meantime, to catch up with past episodes or to check out the latest orthodontic industry news, visit our website at orthodonticproductsonline.com. Until next time, take care and stay safe.